I was a carer for my mother for 15 years, and that had an impact on me. And I was really keen to use my experience, not only as a carer, but my professional experience to really support the NHS. And I can hand on heart say that I have learned so much about leadership. Absolutely, I would definitely suggest that you apply immediately if you think that you have the right skills. My name's Judith Seymour. I am one of the non-executive directors here at NHFT. I also hold the title of Senior Independent Director, which is sort of what appears in the screen, which allows me to step up and support the Trust in a slightly different way. The roles and duties of a non-executive are actually prescribed, and they fall under four categories. One is in relation to supporting the Trust with strategy. That's bringing in that independent view, external perspectives, to challenge the strategy that's being proposed, and to really work with the executive to develop the Trust's long-term direction. And for us at NHFT, that is Thrive, which is our group strategy, which we put into effect over a year ago now, so it's quite new still. And we really brought that external vision to it and challenged not only the deliverables, but also as to where we were going as a trust. The second aspect is around governance and oversight, and this is a really big area. We need to ensure that the trust complies with statutory requirements, just as the executives need to do too. We look at best practices, and we really look at and robustly test financial and quality controls. That's really our main focus, and we do this at NHFT through what we call level 1 committees, which are the Quality and Safety Committee, the Performance Committee, the People and Culture Committee, and the Risk and Audit Committee. The third thing that we need to do is really focus on patient and public interest. We really have to be acting as guardians for the best interests of staff and patients and local community. And at NHFT, we do this through service visits. So all NEDs are quite active in going out and visiting our very varied services. We also take data from the individual level 1 committees, and we triangulate with other information, for instance, from service visits, but also what we may have heard from our governors. And we bring that into board and board discussions. And we also have the patient stories, patient carer stories and staff stories at board. And the final thing, which is thankfully quite a small part of the role at NHFT, is to support executive appointments. So we lead on the remuneration of executives, so we need to check that around appraisals and around appointment or removal of executive directors. And what really the sort of all these roles that bring together, they are translated, these prescribed duties, they're translated by each trust to be unique to their own organisation. So within NHFT specifically, we're a foundation trust, but we have also recently gained advanced foundation trust status, as well as very, very recently integrated health organisation status. And the role of the NED has been really to work together with the executives to drive the application to a successful end, which we have. I think it's fair to say that the whole board does this, NHFT, because unitary board, we do work together, the NEDs work in partnership with the executives, we challenge them, but we are fundamentally all pushing in the same direction. For each of our NED duties, what we do is we go back to that independent external experience, and we bring that to bear to NHFT and what NHFT is doing, and we really drive and push towards being that best in class through either challenging the executives to make sure that we set targets which are achievable, but they're a stretch. Also using benchmarking and national data where relevant, so that we understand what the comparatives are, and to learn from other organisations who do better than us and continuously improve, and also through innovation. And at NHFT, we specifically do well, I'm really excited by the Dragon's Den concept, where the medical director, a non-executive, and usually somebody from finance, challenges the application of staff members on bringing in some innovative product or different way of offering a service to patients, which actually improves the experience. And they are given some seed capital funding to get their idea off the ground. So it's a really interesting and exciting way of doing innovation, and that involves staff. I think anybody attending a board or a committee meeting would recognise quite quickly that the NEDs are a pretty passionate bunch around this, as well as the executives who live it every day. And I think there is evidence to show that at least one of us in any specific series of questions will bring the conversation back to the interest of patients and service users specifically, and staff as well, depending on the nature of the conversation. We definitely go out with this in mind when we go on service visits. I know that the annual staff survey is scrutinised and triangulated with data from our PALS data, from complaints, from freedom to speak up. We also have staff and patient and carer stories at board meetings to really set the agenda at the beginning of the day, because you cannot forget why you're there once you've heard those stories. And we ensure really that as a trust we not only listen to that feedback, but we act on it. So a number of occasions we have done, you said we did webinars where we sort of, if you like, evidenced to staff, but also to patients and service users how their feedback has changed the way we've done things. So this is really, quite a sort of central tenet as to who we are at NHFT. Well, there isn't a typical month. I think the easiest way to start is to reference everything that I do as a NED onto our corporate cycle. So our corporate assurance cycle is every 2 months. So our board doesn't meet every month, it meets every second month, as well as our level 1 committees. So the absolute basic commitment is to attend 2 committees, 2 level 1 committees, and the board, which is split into a public board and a private board. And you may attend a committee as either a member or a chair. In addition to the committee and the board meetings, we are a foundation trust, so that means that we have governors. So we have a council of governors meeting and potentially also a workshop. But we also have a sort of informal meeting with the governors, between the governor and the NED community, because during COVID, for example, it wasn't easy to meet. So the meetings went online, and we've kept it going because governors actually fed back to us that, for instance, people with caring responsibilities or full-time work responsibilities found it easier to dial into a meeting. We do meet face-to-face, but we definitely have a governor-led meeting online. We may also have a board or committee workshop, which allows us to gain extra assurance and also understanding of what services are doing or how we do things within NHFT. So that is sort of very broadly the commitment at a basic level. Clearly, as you take on additional responsibilities like chairing committees, or in my case, being the senior independent director, there are additional meetings, but that can sort of fit round to what you're already doing. I mean, I would expect to be doing at a basic level 3 to 4 days. That may extend as you sort of progress in maturity and experience within the trust. This is quite a challenging question because there really isn't one thing that works. So there isn't a uniform requirement. The group of NEDs here at NHFT, we all bring something very different, both by experiences and skills, but also by qualities. But I would definitely say that as a group of NEDs, and an effective NED would really need to have a very strong element of curiosity as to why things are the way they are and how they can be improved, a really strong sense of support and empathy, not only to executives as a unitary board, but also to our service users, our patients, our staff, and other people whose lives that we impact as an anchor organisation. We need to be a type of person who feels really quite strongly, quite passionately about driving really positive outcomes for the communities that we serve, and really around equity in healthcare. And finally, a really strong adherence to strategic thinking rather than getting operational.